Hello, my name is Brittany Foster, and today I will be presenting my microbiology case study PowerPoint. For my background, I talk about what is wrong with this patient. My patient's name was Olivia, who was 60 years old and a Caucasian woman who came into the ER with her husband. Olivia walked into the registration area, trauma room, and ER with no assistance. Olivia stated that she was at a barbecue before having symptoms of coughing up blood. Olivia also stated to the nurse and doctors that her history was normal, there's no medication that she is on, and has only had a surgery of her wisdom teeth removed. For the first part of my physical and laboratory finding, I talk about the basic health backgrounds done in the ER. Olivia's vitals were 112/70, temperature was 97, weight was 61 kilograms, pulse rate 70, and some more information that was given is that her abdominal was slightly distended. Continuing with my physical and laboratory finding, I talk about the tests completed in the ER for Olivia. Her platelet count was 159,000. Her white blood cell count was 8,000. Creatine was 0.88. Potassium was 3.7. Sodium was 140. All of these tests and vitals were in normal range and not high alert to the doctors or nurses. A high alert finding, though, was when the doctor ordered a chest x-ray, and in Olivia's, it was shown that it was infiltrated in the middle of her left lung with a diameter of 1.9 centimeters, which had also signs of cavitation. Then I move on to the diagnosis, disease, and organism discussion. Olivia's diagnosis and how Olivia was diagnosed. Olivia was officially diagnosed with tuberculosis. Some additional test was that she had tuberculosis was a skin test done during her stay. She also had a sputum test, which results came back in 3 weeks. It was done as an acid-fast stain that came back with positive round clusters of Microbacterium tuberculosis. Some extra information is that tuberculosis is known as a chronic disease caused by Bacillus Microbacterium tuberculosis. That is why the sputum test was needed. And for what the skin test is a 2-step process in the forearm using a 0.1 milliliter of tuberculin purifies protein derivative. I will show what these both look like later on as pictures, including what a chest x-ray looks like with a positive tuberculosis patient. After Olivia was diagnosed, her doctor put her on a treatment plan. For starters, it was a 6-month treatment plan. Additionally, she had 3 more months, making it a total of a 9-month treatment plan. For the first 6 months, though, we broke it down into the first 2 months, having 3 medications called rifamycin, 500 milligrams, isoniazid, 200 milligrams, pyrazinamide, 1,500 milligrams. These are all standard first-line basic treatments for tuberculosis. She handled those well, and they were reduced in the last 4 months to half for all 3. Education that the doctor and nurses gave her was that even when the symptoms are gone, and hers was only a bad cough in the blood, is that the patient needs to stay on the medication so that it can completely be out of the system. Olivia, thankfully for her outcome, listened to the doctors and nurses in education and took the medication correctly, so she survived her disease. Olivia was isolated a lot in the beginning of her treatment plan due to being in the hospital and having no visitors and having proper PPE on the staffing so they could only go in when needed. And when she got home, she was very isolated for her husband for many months. Olivia did handle medication well, and that is why it was sent home with her. And Olivia's main side effect was the bad cough. They got rid of the coughing of the They got rid of the cough with spitting out the blood during her hospital stay. Then I show what tuberculosis looks like. Like I said previously, I would show on the top left picture. The tuberculosis is showing up in a chest x-ray on those 3 arrows, and you can see how it is infiltrated in that circular lung. In the top right, I showed the positive tuberculosis skin test. Again, this is a 2-step process that usually has to be given and then looked at 24 to 36 hours after given. This one is bubbled and round and a big diameter. If it was negative, it would be flat with a 0 diameter. And on the bottom is the anatomy of Microbacterium tuberculosis. It shows the waxy cell walls from the myotic acid and the acid fast. It shows that is a rod shape, that it needs oxygen strict aerobes, and it shows that they can be bright red. So, for the summary on patient Olivia, her personal information is that she came in, she's a 60-year-old woman, healthy Caucasian. She stated that before coming in, she had a barbecue with friends and family, and started coughing up blood a day after the barbecue. For the disease information, Olivia was diagnosed with tuberculosis. Her treatment plan, she was put on 3 months medication. She was put on 3 medications for a treatment plan. The treatment plan was 6 months, and 3 more months were added on after being reevaluated. The disease can be easily spread and quickly was the education that the doctors and nurses gave to Olivia, and that is why she was isolated. And the outcome information is that Olivia was able to survive this disease, thankfully. Olivia had to be isolated again during the hospital stay when she got home, and during these times she found out that friends and family also had it who was at the barbecue. Nobody knows who gave it to who, but all were thankfully survivors. And the patient was reevaluated again after 6 months of this and stayed in the medication for 3 more months. That is my presentation on my case study for Olivia who had tuberculosis.